This exercise is called 3-month supine with a focus on controlled leg lowering. So we're going to start off in our 3-month supine position. So for review, we want that back mashed against the ground here. We don't want any curve here. We want to create some intra-abdominal pressure, so some ballooning out of the stomach. We want to make sure my neck is nice and tall. It's nice tall cervical spine here. We're going to bring our feet up to about 90 degrees here, or just a touch past that 90-degree marker. Again, while holding this pressure, we're going to focus on extending one thigh at a time down towards the ground in a very slow and controlled movement. So it looks something like this. You can keep your hands here if you want to cue up that pressure. Extending one leg down, bring it back up, extending the other leg down, bring back up. Now, as we're doing this movement, we want to make sure we're not creating extension in the back. We want to keep that back flat against the ground the entire movement. We don't want to lose pressure in this abdomen. We don't want any popping, clicking, or pain in our hip or low back. If we're having any of those symptoms, it's a sign that we don't have enough pressure in this canister. So for example, let's say you get a pain or a click in the hip when I get down to about here. What I want to do is make sure I triple down on my pressure. So even more pressure here. Try that movement again. It should be pain-free and noise-free, but if it still causes a pain at that motion here, what we want to do is still keep that pressure, but go just in front of it. We don't want to keep encouraging the pain or clicking noise. We can typically do these for about sets of 10 per thigh. The other thing we may want to focus on is I don't want you to think about this as my hip flexors lowering down my thigh from that position. I want you to almost think about it as extension through my hip. So if you can even cue up a little bit of glute extension, so some of that hip extension here, that will help take a lot of pressure off the front side of my hip capsule as well as my quadriceps muscles. So again, these movements look like this: nice retracted neck, back mashed against the ground, ballooning out that stomach, feet just above 90 degrees, slight external rotation of my hip, and just kick these legs out, making sure each one is back in the dock before the other one returns. Good. Now this is, again, an excellent progression from our 3-month supine, especially for lower back complaints.